Good afternoon, everybody. My name is Kathy Redmond. I'm editor of Cancer World, which is the magazine of the European School of Oncology, and we're one of the partners in this very important European initiative, the European Partnership for Action Against Cancer. And I'm very pleased to have the opportunity to moderate this press conference. And I'm really pleased that we have this group of eminent policymakers who are going to talk to us this afternoon, quite briefly, about meeting the challenge of cancer in Europe, which is a very, very important public health issue today, and certainly it'll be an increasing issue in the future. So without further ado, since we have some time constraints, we have the open forum starting at 4 o'clock. I would like to ask our first speaker, who is John Daly, who is the European Commissioner in charge of health, and I'm going to ask him just to speak to us about how Europe is meeting the challenge of cancer today. Thank you very much.
Well, thank you, ministers, ladies and gentlemen. I am delighted to be in Rome today to participate in this forum. The fight against cancer, and in particular cancer prevention, has been at the forefront of European Union action for the past 25 years. From the first cancer program in 1987 to our present partnership against cancer, the Commission has fostered action on prevention, research, control and care, which made a difference for Europeans living with cancer. This year, the Open Forum focuses on cancer information and cancer prevention. Information is key for shaping and implementing effective cancer prevention and cancer strategies. The Commission is committed to fostering a sustainable, comprehensive European cancer information system. As for prevention, the Commission is keen to use all the tools at its disposal to help people avoid cancer by making healthier choices as early in life as possible. Smoking is the biggest preventable risk factor for cancer. We need to ensure that people know what tobacco does to their health and to make tobacco products less attractive to young people. It is in this spirit that the Commission is currently revising European law on tobacco products, that I encourage governments to ban smoking in public places, and that I have launched the campaign Ex-Smokers Are Unstoppable. I am pleased to hear about all the action to raise awareness about cancer, but put in place by organizations such as the Association of European Cancer Leagues. In particular, action to reach out to young people during the week against cancer in May. I am encouraged by progress in member states such as Italy, Slovenia, and many others in implementing national cancer control plans. The European Partnership is supporting member states in this process by fostering exchange of knowledge and developing guidelines and indicators to help them. My message today is simple. The Commission is committed to support cancer prevention and control, and will continue doing so for the years to come. Thank you very much.
Thank you very much, Commissioner. The four speakers will speak, and then we will have time for questions at the end. I would like just to move on with the speakers, and then I'll just make some comments at the end, particularly around some of the initiatives that are part of the EPAC program. But I'd like to move on to our next speaker, which is Professor Balduzzi, who is the Minister of Health for Italy, and he's going to talk about the effort Italy is making to meet the challenge of cancer.
Grazie Miss Edom, grazie per questa moderazione.
Thank you for moderating this round table and for organizing this press conference. I should underline the fact that it's a great honor for Italy to host this Open Forum 2012 within the Action Against Cancer, the European Partnership for Action Against Cancer. This is a witnessing of the effort that Italy is making in fighting cancer to promote the scientific research involving the nation so that they can promote the activities of public health institutions, so to help plan a care system in order to prevent and treat, but also to rehabilitate the patients. And this is one of those frontiers that are coming up and which we have to face in order to implement treatments and recovery systems, just like our commissioner was pointing out, who I do thank heartily, actually, for a number of things. First of all, on how the way he's doing his job as commissioner, and for how the commission is acting in very delicate domain, like the fight against cancer. The Open Forum is an evidence that we are embarking on a joint action, which is promoted by the Commission and whose stakeholders are member states, but also the research world, the investigation world, the healthcare professionals, associations, volunteers. So these domains are all included in this partnership, and their presence is key to win this battle against cancer. Italy has launched a number of programs in this sense, and within the joint action, Italy has been involved very actively and together with its healthcare institutions, and this gives momentum to what we do and what we want to do. And so this is one of the reasons why we are so glad to host this Open Forum 2012, which is a reason to be very proud, and which will give more stimuli to our activities. And just 3 weeks ago, in this very auditorium, on the World Tobacco Day, that is a day aimed at raising awareness among civil society on one of the risk factors, the main risk factor, that is tobacco. And we had the chance to highlight how our country has done in this sector, trying to meet and welcome that encouragement that our commissioner was mentioning before. So I would like to thank two people in particular who are around this table, and I'm talking about Alois Peterle, who is one of the most known politicians in the New Europe, so he doesn't actually need to be introduced. But he's also president of the European Member of Parliament Against Cancer, and Italy is involved and with the Ministry of Health. So my regard goes to Thomas Gant, Minister of Health of Slovenia, Thomas Gantar, and he's also a very good friend of Italy's. And this is not a a mandatory requirement in order to, to participate in an open forum, but we are really glad when we meet friends and when we join forces to do something that is aimed at protecting our health and the health of all our citizens in all member states. So thank you all for being here.
Professor Balduzzi has said that we have two friends of Italy here in the room, but we also have two very strong friends of cancer, because the cancer world needs champions. And the two champions come from a country which has been a champion of cancer in recent years. Italy has certainly been a champion of cancer, but a small country like Slovenia, it's a little bit more difficult. And those of us in Europe who come from small countries like Malta, Slovenia, Ireland, sometimes it's hard to have an impact, and I'm really pleased that we have two policymakers from Slovenia, because Slovenia has certainly punched above its weight in terms of cancer in Europe. So I'd like to invite first of all Dr. Ganter, who is the health minister from Slovenia, and he's going to talk a little bit about EPAC, because of course Slovenia is leading EPAC and are doing a tremendous job in leading EPAC, but also talk about the tremendous efforts that Slovenia has made of late in terms of cancer.
Thank you very much. Egregio signor Ministro, aspettabile signor Commissario, gentili signore e signori, è un grande onore per me partecipare a questo Open Forum. Nelle nazioni con una lunga aspettativa di vita, il cancro sta diventando una delle principali cause di morte.
Tend to be one of the main risk factors for life, and this is one of the major concerns for the European Union. And Slovenia, during its mandate as in the presidency at the European Council in 2008, put a prevention system on the agenda for cancers, various types of cancers, and putting this topic under the spotlight in the European Community agenda. And there has been another initiative by the European Parliament, while the European Commission paved the way for a Action Against Cancer partnership, which was subsidized by the public healthcare program. And we have a range of ambitious programs, like diminishing the incidence of cancer by 15% by 2020, and I'm very satisfied about that, because the CAP guide is entrusted with Slovenia, and this is a main challenge for Slovenia. The CAP model and the shared measures are another added value to the program, because experts and specialists at the European level, EU level, participate in prevention campaigns and actions, and they also disseminate and interchange information as to clinical practice and on-the-ground experiences in order to implement the proposals that have been tabled. Member state citizens, what can they expect from the CAP program? Well, all the information spread on cancer are gathered and coordinated within the European Code Against Cancer. And since screening programs are so important within the CAP, there will be an education program through which member states, already experienced member states, can involve member states which have not implemented those programs yet. As to the experiences, this is going to be very important, because this is the only way to provide a high level of satisfaction. Within CAP, we have clinical rules to treat and cure childhood cancer types, and in this domain in particular, CAP and collaboration are of greatest majority. I'm deeply satisfied for the fact that Slovenia is now coordinating a vital program. We can contribute to make this project be successful by sharing positive and evidence-based results, and to improve primary care programs and to promote screening plans and programs. We've been successful in reducing colon and uterus cancers and a variety of other cancer types. Furthermore, our cancer register is one of the richest in Europe, and it gathers measures aimed at preventing cancers. This is a very important field, and I'm truly convinced that there will be larger debates in the future representing many other projects. Thank you.
You mentioned the European Code Against Cancer, which of course is being promoted as part of the EPAC program, and the Italian Cancer League has made a very important contribution to this in running the European Week Against Cancer this week or this year. But also I would like to acknowledge a person in this room who was around at the very start, because of course the European Code Against Cancer was first developed 25 years ago, and it's a great testament to what can happen when people collaborate at a European level and the power of European partnership, because that code has stood the test of time. It's been revised 3 times, and my organization, the European School of Oncology, was very proud to be involved at the start of that. But the civil servant behind that, who really was the powerhouse behind that, was Michel Richonier, who is here and will speak this afternoon at the open forum. And that's a very, very important piece of history that should be acknowledged. And again, sometimes we're very skeptical about Europe and the power of Europe and the European Union, and we forget to acknowledge that sometimes Europe plays a really, really important role in public health and can make a difference. And that's something not to forget. Our last speaker, Mr. Peterle, who's the real champion of cancer in Europe, he has done a tremendous job in really raising awareness about some of the incredible inequities that exist across our member states, and has been behind efforts to try and tackle those, and he'll just speak briefly about that.
Thank you very much. Le ringrazio cordialmente, Ministro, per le parole amichevoli. Io penso e sono sicuro che amicizia fa salute. But ho fatto soltanto 10 lezioni di italiano.
I only took 10 lessons in Italian, so I would like to continue in English.
And to be a member of the European Parliament, that I'm a cancer survivor. I was diagnosed with cancer 10 years ago. And I survived, and since then I count from 0, so I feel very young. And 20 years ago, I was still living with my compatriots on the eastern side of the then Iron Curtain. We were not pleased by then political gap or divide in the divided Europe. And since 2004, we have been living in the enlarged European Union. I do accent on enlarged because enlarged could be considered as a quite technical term. Enlarged does not mean really reunited Europe. And we do share the same values and principles. We don't respect always the same rules adopted by European institutions. But despite those values and principles, we are facing many differences. One of those differences is a gap between old and new member states of the same European Union as far as cancer and health generally is concerned. And there are inequalities in cancer incidence, cancer mortality, and also survival possibilities. As chairman of MAC, MAC means Members Against Cancer in the European Parliament. I do share the belief with my colleagues that cancer is not just medical, doctors and patients issue. It's first of all social and political issue. I would say it's also civilizational issue. Cancer has its own strong dynamics, and in our answering we are not that fast as cancer is. I would like to say very, very politically and with responsibility that members of the European Parliament who represent 500 million citizens of the European Union don't like these inequities, these differences. And this is one of the proofs that European Union has still to do a lot in order to get more integrated, less divided, more united. We welcomed very much the launching of the EPAC because this project reflects also our wishes with regard to what has to be done in fight against cancer. And we like that EPAC is developed with new strengths, with an added value as a European partnership of partnerships at different levels. We don't like to be calmed by the explanation that or by the reading of the Lisbon Treaty that health is is a member state's competence. We can't get through with that. Is it true? But is it true also that there are issues, there are challenges we can only address by a common European approach, and citizens themselves also expect much more from the European level. There are many issues member states are not able to address successfully. What is needed after 2 years of this very important project, which has brought new spirit into our endeavors, I think that we have to do many things in order to dynamize this process, which is a huge undertaking of the Commission and of the Member States. I think we should introduce new stakeholders. We should develop new partnerships, not only at the European level, but especially at the national level, even at regional and local level. And we need a strong political will. We need decision makers to support patients, professionals, civil society. In this respect, I would like to conclude by saying that EPAC is a strategic project of the European Union, and cancer is not one of the European problems, but it is European survival issue. Thank you for your attention. Le ringrazio per l'attenzione.
Thank you very much for that, and it's very important to give a patient voice. It's nice that we have a patient and a policymaker who can speak from a patient perspective, because all too often the patients don't have a voice in political decision making. And Mr. Peterle has really given patients a voice at a European Parliament level. I would like, before I open the floor to questions, I would like to introduce the EPAC work package leaders who are sitting here in front of me. I don't know if we've time just to go through them all, but there is various different work packages that are part of the EPAC program. There's a work package on health promotion and prevention, one on screening and early diagnosis, one on health promotion and health care, one on cancer research, one on cancer data, and on national cancer plans. And then the whole coordination, as we've heard earlier, is being carried out by the National Institute of Public Health in Slovenia. And for people, any of the journalists here who are interested in interviewing the work package leaders afterwards about the work that's ongoing, because EPAC, of course, is 1.5 years old. It has another 18 months to run. And there's a lot of ongoing activities. If you're interested in hearing about those, you will have an opportunity between 3:30 and 4 o'clock when the open forum opens. But now I'd like to open the floor to questions to any of the speakers. Can you say who you are and what publication you represent or news outlet you represent?
Good evening. This is Acer Garcia from Spain. I'm writing for the BNJ, for the British Medical Journal. My question, yes. So my question is especially for Mr. Dalli, but any of you probably will have something interesting to say. And it has something to do with what Mr. Pittella said about inequities. We are here talking about cancer, but the fact is that we are talking in a moment where in some countries, and I'm especially talking about Greece, but probably we'll be talking about other countries soon, where they don't have sometimes gloves, or they don't have their clothes in operating theaters, they don't have basic material for attending their patients, and this is something that they are suffering. Also, it happens that Roche, the pharmaceutical company, recently said they want to provide Greece with certain oncological treatments. And my question is, don't you think that European Commission and European authorities have some responsibility in this happening? Is there something that can be done from a European point of view? As in a way, we are all citizens, and Greece is just part of us.
I believe all of us are responsible for whatever is happening in Europe. We have a situation that, first of all, the European Commission has its own function in the health environment, and member states have their own function in the health environment. And the management of health is a member state competence, and I must say that it is jealously guarded by member states. They are very militant not to allow the Commission to interfere in anything that has to do with the management of health in any member state. And it is understandable. I was a Minister of Finance as well in my own country, and health is the biggest spender. And therefore countries are very, very careful to have their hands on the purse strings when it comes to health, and don't want any interference to push them into doing things that are not sustainable within their context. Having said that, I also realize the large inequalities that exist in Europe in any case, even without the economic difficulties that we are passing through in Europe, and where some countries are really having big problems. This situation of economic problems has exacerbated, has increased the inequality factor. We are following what is happening in countries, especially in Greece, and we as SANCO, as the health unit in the Commission, are involved in the economic planning that is happening in Greece. And our purpose to insist that we be there is to make sure that no government takes the easy way in cutting health expenditure unnecessarily. We know that since health is the biggest spender, and the effect of health spending is not an immediate political effect, health is unfortunately the first victim when it comes to cutting of budgets and making savings. And we are insisting, and if you follow what I have been saying over the past months, I have been insisting that health should not be considered as an expenditure, but all spending in health should be considered as an investment in health. because even if we get out, or when, not even, we will get out of this impasse that we are in today. I'm a very optimistic person. But when we get out from these problems that we have economically, what will be the real result if we go out with a sick population in our countries? Population that cannot produce, population that cannot be competitive, populations that, on the other hand, are increasing our health expenditure astronomically and exponentially because of the lack of investment we're doing in these few years. And therefore, we are trying to persuade politicians in all countries not to try and get and exercise what I call false economics by cutting spending unnecessarily in health. There could be cuts that could be made because of efficiencies that we can harness, and there are, I believe, many areas where we must rethink health delivery, because I believe that this is imperative for sustainability of our health in the future, crisis or no crisis. Okay, but it's very, very important for us to make sure that our health trust continues to be there. I've also talked to the medical pharma industry about such problems as supply, and I believe that the pharma industry, although they are quite pressurized today, especially with non-payments of invoices, which are mounting and mounting and mounting, but as far as I know, so far, they will continue to shoulder their responsibilities. Thank you.
Sì, ringrazio anch'io per la domanda.
Thank you for your question. Meaning that, yes, it's important to have a sort of sanitary European health link toward so that there's not a short circuit in that because when when you have the health of your citizens gets worse, then also the expenditure increases. And so, and this should be done at the European level. As far as initiatives, I would like to reassure you, as far as Italy is concerned, but also Slovenia, I would like to reassure the Commissioner, we have to undertake coordinated initiatives, persuasion towards the pharma industry, etc., aimed at developing cooperation networks among the member states. And I think these initiatives would be well accepted by member states, and most of them would not look at them as an interference on the part of the Commission. So the Sanco, Commissioner Dalli, and the European Commissioner have shown during the past year to be clear that about their distinction between competencies of the European Commission and the member states. So what the Commissioner said, that we should make the necessary cuts, but not health services. And I think that maybe some initiatives should be taken by the European Commission, something that we could define a European health link court.
By Mr. Commissioner and Mr. Minister, I don't like to be educational, but I consider crisis as a kind of illness, I would say social illness. A crisis usually is a message which tells us what we were doing wrong with our decisions in the past. And I'm not the only one who thinks that crisis also could mean a good opportunity to change something in our behavior, in our political decision-making process. I think that Greece will face a recovery process, which will demand very strong commitment, very strong sense for responsibility. I'm sure that European Union will do its share according to the treaties, but the main field of work will be in Greece, and I'm a little bit more, I would say, calm after the results of the elections 2 days ago, because pro-European forces won, but I will face a great responsibility. I do wish Greece that overcome these problems, and we know that we do reforms when we don't have enough money, you know. And this is not just Greek problem at the moment. All health systems in the European Union, I think, face similar problems. And this is time for innovation, for new ways, for, I like to say also, paradigmatic change. Thank you.
Hi, my name is Jurila. I work for Lithuanian Public Radio. My question is a little specific, but it's related to cancer treatment, and it's for the Commissioner. There are discussions in quite a few of the European countries whether they should have not only private but also public cord blood banks for stem cells. I was just wondering whether the European Commission has any kind of a position or recommendations for that, and also how important stem cell research is for cancer treatment in Europe. Thank you.
In fact, the Commission already has specific directives and regulations on how any type of cells or other organs are kept, and also how they can be harvested, all the conditions pertaining to this, and how they are to be used. So this is something that the Commission is very specific about. On stem cell treatment itself, this is a developing science. I am myself, very open to research that is being made on stem cells. And as you know, in our research budgets, we do subsidize research on stem cells quite excessively. We did that in the past, and in the new Horizon 2020 proposes stem cell research is also part of the sectors that will be subsidized.
Other questions?
Maya Dancheva, Bulgarian National Radio. Commissioner Dalli, I'm glad to inform you. On the 1st of June, Bulgaria stopped smoking on the public places. But Bulgarian people, they are very interesting people. They believe that is for a short time, for a few months, for a few years. How I can explain them that rule is forever? And I want to ask, my country, Bulgaria, is one of few countries in Europe who have not national cancer plan. What you recommend us? Thank you.
Well, I am also very pleased that Bulgaria introduced this law. A couple of months ago, I was in Bulgaria myself, campaigning and meeting with the Prime Minister, trying to persuade him to bring this date earlier, because he was thinking about late next year. So I'm very pleased about that. The thing is that the question of introducing this type of legislation, which has been introduced in most Europe, the question is implementation. And the only persuasive element that can be put is naturally pushing it in the media. The media can help quite a lot in pushing these ideas, but also in having implementation and enforcement in the countries, because then that is when people would understand that this is something that is going to improve and not just stay, but hopefully be expanded and improved. In my country, Malta, for example, they've now abolished smoking also in playing fields where there are children, so that children wouldn't also be put in touch with the habit itself. Therefore, no, this is something that has to go on. And the second question was?
National Cancer Plan.
The National Cancer Plan. Now, one of the things that we are working on now with the cancer program is in fact to ensure that national cancer plans are introduced in all countries, but not only that, but also to be very proactive in pushing best practices from one country to the other. So I hope that in the very near future, we will also be talking to Bulgaria to introduce
very strong tobacco legislation for a while on how to ensure the long-term sustainability and to
Beh, noi abbiamo avviato.
We have started a number of initiatives towards which are both prevention and initiatives. There was a very courageous initiatives by one of my predecessors aimed at prohibiting smoking in public places. We were also worried at the time, as Mr. Dalli was saying, concerning the implementation of these laws. Our experience was positive because the rules were generally observed, and we were also successful. We were lucky because we were able to reduce year by year the number of smokers, especially young smokers. The percentages are still high, but it's important to prohibit smoking, but also to have constant awareness campaigns, and also give positive examples against negative models, and also some rules that can be adopted. For instance, the ban on the sale of cigarettes to minors, or the packaging of 10 cigarette packs. You know, they may seem like just details, but if you put them all together, they make up a coordinated action, a policy against smoking. So we have to put together all the pieces and never, just go one step at a time, because the tobacco industry naturally is very strong, and it's unthinkable that you can overturn the situation. But the efforts that some of our member states, including Italy, have made are starting to show their positive outcomes.
My name is Katia Apostolidis, and I am from Athens, Greece. And I have a question for Commissioner Dalli. What is the role of the European Commission in the policy and technology transfer from countries with well-operating healthcare systems towards countries that need to do reform theirs, and particularly for countries which are under the austerity measures: Greece, Portugal, Spain, Italy, Ireland?
Well, the policy is that we do organize constant meetings amongst the various countries to discuss and review practices in the health system on sometimes specific subjects. We have platforms also on which we bring all stakeholders in to discuss these questions, and the basis is, as I have said before, to try and push best practices. However, we're going now beyond that. Now, in my DG, we are organizing a unit that is specifically geared towards advising member states on health policy issues and health implementation issues when we are asked to do so. Again, I underline that because of competency reason. Therefore, we're not going to interfere with any member state, but if we are going to build up a network of experts who, when asked and if asked, we will be able to assist in working with them on how to organize their health system, or how to reform their health systems, where certain efficiencies can be gained. To give you an example, recently I have had a request, for example, by one of the countries to assist them in building or constructing or planning to construct, to put it that way, a child hospital. Okay, so they were asking me, for the plans, which is the good thing to do, because I always say I hate waste and duplication, repeating ourselves, copying each other, starting afresh to find solutions that were found in other countries is all waste. And I think by passing on this knowledge, I think it is very fruitful. My last comment is that my colleague, Commissioner Dehaene, in his new proposals on the structural funds, has now also introduced the concept that health projects can themselves be eligible for structural fund assistance. This was not true previously, but from now on, our proposal, hopefully they go through Parliament and they go through Council, but that health projects can be eligible as health projects for structural fund assistance.
Thank you very much for that, and that's a really nice note to finish the press conference, because again it's reinforcing the importance of partnership, the importance of collaboration, the importance of this European value we have of solidarity, that we help each other and that we need to avoid wasteful duplication. I'd like to thank our 4 speakers here today. We'll hear for the contributions. We'll hear them later on at the opening ceremony of the open forum, and I hope you all stay for that. Thank you very much.
Thank you.